Today morning I was taking round at emergency department and I saw one elderly female. She presented with shortness of breath for one day. And while in round, I saw her ECG, and one intern rotating with me commented that she had Q waves in lead 2-3 AVF. So he told that she may be having myocardial infarction because Q wave can occur even in acute MI or healed MI. So even if it is world MI, you can get Q, or sometimes even in acute MI you can get Q waves. Her troponin was negative. When I saw her ECG, Q wave was not that significant. When do you call Q wave significant? So when it is more than one small box width wide and more than two small box depth, or more than 25% of the QRS complex. So if it is more than 1/4 of the QRS complex in depth, and if it is more than one small box wide, then we consider Q wave as pathological. Actually her Q wave width was like one small box, but depth was not that much. It was like 1.5 small box, like that. But she was having shortness of breath. And her Q waves were present only in 2, 3 and AVF. In these only 2, 3 and AVF leads. So can it be myocardial infarction, either old or new? I say it won't. Because Q waves can occur normally in left sided leads and 2-3 AVF as well. So the direction of depolarization in the heart starts from left to right? So the direction of depolarization is from left to right. So you can get normal Q waves in left sided leads like V5, V6, or even in inferior leads like 2-3 AVF. But when you see any Q waves in right sided leads like V1, V2, then it is suspicious, right? We should rule out pathology, anterior myocardial infarct. But in left sided leads and 2-3 AVF, if the width and height of Q wave is not meeting criteria for pathological, it can be a normal finding. Sometimes lead placement, if you reverse the lead placement in upper arms, then also you can get Q waves. So actually she had pneumonia, and that was causing her shortness of breath. But these are some of the incidental findings that we get, and we should use our clinical judgment during these types of scenario.